Doctors, are your treatment plans about call me maybe? All right, everybody, welcome to the KC CHIROpulse Podcast. You can tell we're going to have some fun today.
Oh, yeah.
So I'm Dr. Michael Perusich. This is Dr. Troy Fox. We are your hosts today, as most days. And I want to thank Chiro Health USA for being one of our sponsors as we dive in here. But, Troy, this topic is such nails on a chalkboard for both of us.
It is.
When doctors don't want to make a recommendation, they're scared to make a recommendation, or they don't want to make a recommendation. I mean, there's probably a bazillion reasons. And they just tell the patient, call me when you feel like it.
Yeah.
And what am I thinking as a patient? Did my doctor just quit me?
Yeah.
What do you mean call you? I don't know when to call you.
What are the parameters? Yeah. What are the parameters for when I'm supposed to call? So they come up with their own idea. And quite frankly, that's poor vision by the doctor. It's poor care for the patient. And we look at it as, and I hear this often. So this is why it's nails on a chalkboard for me. A lot of you, it's poverty complex.
It is.
And doctor authority. You either lack doctor authority or you have poverty complex, or both. And we're going to talk about both of those. But man, it drives me insane when somebody drives up in a new Lincoln Navigator, just got their nails done, has diamond rings on every finger, and you're going, gee, I don't know if they can afford my treatment plan. How about you just call me when you want? It happens. And if you're honest with yourself, all of us have done it at some point or another. We've underestimated a patient and said, we'll do such and such. I even had one the other day that I literally told the guy, we were working with some plantar fasciitis, and I wanted to try a treatment with him. And he was kind of a newer guy. And I said, listen, I want to do this, and then I'm going to put you on the schedule next week. And I hadn't created a treatment schedule for him yet because I wanted to see how he responded day one to this treatment.
Sure.
And he literally almost scolded me because I didn't put him on a treatment schedule. And then I explained to him why I wasn't. But he's like, money is not an object. I'll do whatever you tell me to do. And I thought, wow, wouldn't it be nice to know when our patients already have that in their heads? But he actually verbalized it. It's like, why aren't you putting me on a treatment schedule? So I explained it to him and I said, I am going to the next visit I see you. Today is evaluation, a little bit of treatment because I want to see how your body responds to this and whether we're going down the right track right off the bat. Because I was telling him what I'd like to do is my goal is I don't throw the kitchen sink at you if I don't have to. And that's the goal, right? With all of our patients, we want to be fair and honest with them.
Exactly.
So don't need to, we don't need for them to pull up their online account for their banking and show you how much is in their account before you make recommendations. It's not your job. Stay out of their pocket. All right. Ran over. That was part of the call me maybe thing that really drives me insane when docs try to get in people's pockets and understand how much money they have.
And like you said, Troy, I mean, there's absolutely no reason to do that. Be a doctor, have the authority, and make your recommendations. So we need to take one of those break things. We need to take a quick break. We need to take a break thing and hear a quick word from our sponsors. But when we come back, I want to dive into this just a little bit deeper. All right, we'll be right back, everybody.
Affordable care shouldn't mean undervaluing yourself, but most chiropractors are still undercharging, especially when it comes to insurance allowances and cash patients with limited coverage. Chiro Health USA helps chiropractors charge appropriately, get paid well when insurance is available, and still serve patients with no or limited benefits, all through a compliant discount medical plan. The result? Doctors stop undercharging, raise fees, and increase income by about 20% without sacrificing care. That's not a discount strategy, it's a business strategy. Learn more at chirohealthusa.com.
Okay, welcome back, everybody. We are talking about the call me maybe treatment plan thought process. We also call it the PRN mindset. And, it just, in my opinion, this just doesn't have a place in the chiropractic world. You go to a general surgeon and they take out your gallbladder. And once your gallbladder's out and there's no infection and you've healed up, there's nothing left for them to do as far as the gallbladder goes. So PRN makes sense.
Yes.
But how does it make sense in the chiropractic world? I mean, when we think about how the spine actually works, with a bunch of vertebrae, a bunch of bones stacked on top of each other with a marshmallow in between, and you think about things like the physiological law, Wolff's law, where abnormal pressure on normal tissue causes plastic deformation, which is what we see all the time in the spine. And you think about what our patients are doing and the culmination of what they've done before they get to your office, where in the world does PRN come from? Because what's the patient going to do once they're out of pain? They're going to go back to doing whatever brought them into your office in the first place, whether it's an overuse syndrome at work, too much golf, too much bowling, standing at the kitchen counter, whatever it might be, bending over and changing diapers, whatever it might be, it's going to continue to cause insult to that spine. And this just is representative, in my opinion, of the ongoing need for chiropractic care. That was a
Absolutely.
soapbox statement.
Yeah, and I mean that soapbox statement is perfect because the truth of the matter is who are we to take something that takes time and repetition? And we famously used the Journal of Spine that talked about it taking a full 18 months for a joint to heal. And we've talked a
Yep.
little bit about that in other podcasts as well. The truth of the matter is we all know it takes time and repetition. If if we were able to heal people in one visit, A, we'd walk on water. B, there'd be people lined up around the block to your office. There are the occasional situations where you take somebody that's had pain for 30 years and you adjust them one time and their pain's gone. Does that mean the joint's healthy at that point? Let's be honest with ourselves.
No, of course
Take
not.
time and repetition to get a joint to respond. So the calming maybe or that PRN mindset goes against good judgment of care for patients. So I look at it from a standpoint of saying, have you done the patient a disservice if you just drop them after one visit and go, well, you just call me?
Yeah. Maybe give me a call if the pain comes back. And so now what we've done is we've made ourselves an owie practice. And if you have a pain management clinic, that's fine. I'm not saying that's necessarily a bad thing. But if that's just your overall approach to chiropractic care is, okay, got you out of pain, that took 4 or 5 visits, got you out of pain. And, I understand now that you don't see a need for further care. So potentially give us a call if it comes back sometime. But here's what happens in the patient mindset. Okay, you treated him. Pain stays away for 2 to 4 weeks, maybe, and it starts to come back. What does the patient start to think? Do they start to think, oh, it's just time for another chiropractic adjustment? Or do they start to think, is this chiropractic stuff really working?
Or is the chiropractor that I'm going to really working? How many
Exactly.
times have you and I've seen it many times where a patient comes to me. I had one last week. When was the last time you got adjusted? Monday, and it was Wednesday. I
Yep.
go, why are you seeing me? Because I heard from my friends that you do rehabilitative care, that you spend time with patients until you get their condition better. The chiropractor I went to just adjusted and said, call me again if you need me. True story. I mean,
Yep.
I didn't make this up today for this podcast. I could have because it's happened many times in the past, but this actually happened last week. And the guy that I was talking to was a very educated person that just said, listen, I already understand how chiropractic works. I've spent a lot of time looking at it online. And he goes, I think it's fascinating. He goes, but I don't understand the one treatment model. That to me, it doesn't make sense. So here's a person of lay, lay,
Mhm. A layman.
they're a layman that is telling me that he doesn't understand a single treatment model. And I'm
Yeah.
like, man, boy, isn't that a breath of fresh air? And I'm like, well,
Right.
too bad for the other chiropractor that really, and I said, well, what did you think of the adjustment from the other chiropractor? It was fine. I just didn't understand why he didn't have me come back. So he goes, so I've talked to friends and I called you. Sometimes the chiropractic, and I hate it when chiropractic takes it under, you get chiropractic gets thrown under the bus because somebody doesn't get better or the pain comes back.
Yep.
But it's not much better when the chiropractor gets thrown under the bus because then we hear you, and I hate when I see this on Facebook. You guys have all seen it before. Who's a good chiropractor to go to? Oh, man, come on. We're all good chiropractors.
Of
I don't want
course.
to leave you out there that aren't good chiropractors. We're all a little different in how we practice, but we're good chiropractors. But look what that created. And I believe that part of it is because of that PRN mindset.
Yeah, and I think, your patient who got adjusted on Monday and is back on Wednesday, understanding that, the one and done idea isn't always a good plan.
Mhm.
I think more and more people are getting that.
Yeah.
And there's so many people out there that are looking for a long-term solution that helps them maintain function.
and are willing to pay for it.
And
That's
I'm
the
willing,
thing. You're like, hey, I'm fine with paying for care as long as it keeps me functional and mobile, which goes back to ADLs, which goes back to why we're treating the patient anyway. It's not pain, it's function.
right. And that's not primarily, that's what we do.
Yeah.
We are about the long-term functionality of the human frame. And we're kind of the only ones out there that do it. I guess the PTs could, but they're so pain and post-surgical focused, which is fine. That's a great market. They can have it as far as I'm concerned. We're about the entire kinetic chain.
Right.
And so when you take that into consideration, and if you really dig into a patient's history and all the things that they're doing that create that repetitive joint trauma over time, micro trauma, I don't even understand where the 4-week model for maintenance care came from. Even that to me doesn't make sense. I mean, Troy, how often do you get adjusted?
I get adjusted every week, as do
Yeah.
a bunch of my patients, because we'll offer it. And you always told the great story about how somebody goes, how often do you get adjusted? And you were like, every week. And they're like, well, why am I not getting adjusted
Yeah,
every week?
that's
And I'm
exactly what happened.
Hey, and there are some people that go, "Oh, there's no way I would come once a week." And there's some people that say financially, I can't afford that. And that's fine. But a cadence of care is developed based off of what you need. And here's the thing. My recommendation to you, because two things, Mike, as I work with you, number one, I work for you. And number two, we work together as a team. As I make recommendations to you, you're going to evaluate those and tell me what you think. And that's how the teamwork approach goes. So if I say I'm going to see you every day for the rest of your life, you might look at me and go, you're crazy. But if I look at you and say, I'm going to see you weekly because you've got a pretty chronic condition that requires care and you're really functional when you get seen weekly, you may go, I think that's a great idea and I'm willing to do that.
Yeah.
So when you are doing a negotiation, and it is a negotiation because you are going to have patients that go, I'd love to do weekly, doc. If I could be in here every day, I would, right? You got patients like that.
Sure. Yeah.
But you're going to do a negotiation and the patient's going to say, you know what? I get paid every 2 weeks and I can get adjusted every 2 weeks. And it is valuable for me to do that. We've determined a cadence of care, not only based off of their finances, but the original reason for the cadence of care, which was, you know what? You'd really benefit if I could see you weekly, but we play Monty Hall. Let's make a deal, because here's the thing. I can't twist your arm. If you don't have the finances to get adjusted, you don't. If you're honest about it and you get paid every 2 weeks, well, guess what? I'm going to meet you in the middle and we're going to keep you as functional as we can. So there's a real art to finding out that cadence of care for patients long-term. And now there's not a call me maybe, right?
Right. And there's an art to explaining to patients too, why that once a week type care, if you will, is important. And I would always tell patients after that experience I had,
Yeah.
when the patient asked me, how often do you get adjusted? Which was a big light bulb that went off for me. But I
Right.
used to use that all the time. I get adjusted every week. My staff would tell patients, oh, they get adjusted at least once a week. I mean, Marissa would sometimes get adjusted 3 times a week.
Right.
And people would look at us and go, well, you're really healthy. Yeah, because we get adjusted more often and we give you access to that if that's what you want. And so I realized early on that I needed to make my recommendations for wellness care, not on the 4-week cycle or the every quarter cycle, like I hear some docs do.
Mhm.
I started making my recommendations. So my recommendation is every week. If that
Mhm.
doesn't fit into your lifestyle or your finances, that's fine. We can try every 2 weeks. We can try every 3 weeks. But I would rarely let anybody go past 4.
Mhm.
Most of my patients, I'm going to tell you, probably 75% of the patient visits I saw every month, which I saw a high volume of patient visits like you did, Troy. 75% of them were coming in once a week or every 2 weeks.
Mhm.
And, it took me a while to really get them there, but not because it wasn't my recommendation. It was my recommendation for a long time. And so this is where it comes back to doctor authority. And I think
Mhm.
we have to not be afraid to make the recommendation that's right for the patient. The patient can choose something else, and we can help them choose something else that may be maybe a little bit of a blanket for them and still provide some aid and functional improvement on a slower or smaller basis. But we've got to not be afraid to have that authority to make those recommendations,
Yeah.
period.
If you're only recommending weekly care to the person that came to you and said, the last chiropractor I went to, I was getting adjusted weekly. Oh, great. Let's put you on weekly care. Or even worse, you say, well, let's see you once a month here. Well, they've been getting adjusted once a week. They're telling you, I want adjusted once a week. So if those are the only people, the people that come to you and tell you I've been getting adjusted once a week, and or your staff, because they're not paying for care, if they're the only ones that you ever make weekly recommendations to, you need to reevaluate, because truth of the matter is you believe that they should be getting adjusted weekly or every 2 weeks or whatever that cadence might be for that patient, but you're not offering that because you're afraid to tell the patient the truth. As Jack Nicholson said, movie was that when he was sitting on the stand, you can't handle the truth, right?
A Few Good Men.
Yeah, A Few Good Men.
One of my favorite movies.
So I'm just going to tell you once a month instead. No, we need to be forthright. We need to have doctor authority with our patients. We need to share our knowledge. That's why they're there. People,
Right.
they came to your office because they trusted you as a healthcare provider. They're not asking you to make a financial decision for them. They're asking you to make a healthcare decision with them, to coach them.
And can you imagine what the patient's mindset might be if they ever found out that you told them to come in every 4 weeks, when in reality, they really should have been coming in every week? Think about it that direction too.
Bad news,
Yeah. Now all of a sudden, my doctor's not honest with me.
misappropriation of care.
Misappropriation of care. Exactly.
Yes.
So we need to take another break, but I want to kind of dive in a little bit more into the patient's thought process on their side when we're making that. Well, we started off talking about the PRN mindset. Basically, when we're making that PRN, if the pain comes back, give us a call thought process. That's not a
Mhm.
treatment plan. I want to talk a little bit more about that. So quick word from our sponsors. We'll be right back.
Patient numbers dipping, staff overwhelmed, and another marketing idea promising the world but delivering nothing. These pressures feel familiar to nearly every chiropractic clinic today. Across the country, chiropractors work hard, yet many find themselves stuck, balancing patient care with the nonstop demands of running a business. That's where the real strain begins. Most clinics face the same set of hurdles: inconsistent new patient flow, operational bottlenecks, and the constant challenge of staying visible in an overcrowded digital space. National reports show that over 60% of clinics struggle with scheduling efficiency alone, and even more lack a clear marketing strategy that reliably converts. But the good news? These challenges aren't roadblocks, they're signals. With the right procedures, smarter outreach, and guidance built specifically for chiropractic practices, clinics can turn daily stress into sustainable growth. Stronger clinics start with smarter strategies. Grow your practice with confidence. Book your strategy session with CATS Consultants.
All right, everybody, we are back and we're having a great time today talking about nails on a chalkboard.
Yeah.
Yes, I just gave everybody chills up their spine. No, seriously, we're talking about not using doctor authority to make proper recommendations with patients. And, if I sat here and thought about it, when I was very, very first in practice, sometimes I would do that for a patient who was coming in and had been going to another chiropractor. And maybe they told me that, they just tell them, I just come in when I want to. And because I was new in practice, I wasn't real sure how to handle that. So I worked and worked and worked early on trying to figure out, how do you handle that? And I worked with my coach. You probably heard of him. His name's Dr. Katz, on how do you handle that? So we figured it out. But what I realized was there's a whole bunch of people who get the wrong impression of chiropractic if we do that, if we just allow them to pick their schedule, or if we tell them a schedule that doesn't make sense to them. And I'm telling you, just like Troy had the patient that he was talking about a minute ago, people are on to us. People know that repetition is important. They just don't know what that repetition should be for them. So let me ask you guys this out there. Think about this. Does the dentist ever tell a patient that they only brush their teeth once a month? I only brush my teeth once a month. So, you could probably get by with the same thing. No, they don't ever say that. So they make the recommendation to brush your teeth 3 times a day and floss every day for a reason, because that's what you need. Now, do we always do that? No, of course not. But we need to make the same kind of recommendations to patients. We need to tell the patient, you really should be in here with the condition of your spine. You really should be in here twice a week, probably for a long time. Don't be afraid to tell them that. And then let them decide, does that work for them?
Yeah, honesty about their condition, honesty about how the human body heals, and the fact that it takes a lot longer than a week for your body to truly heal. I
Yeah.
don't care if you're out of pain. I do. I mean, sure, I want you to be out of pain, but in the long run, pain does not dictate how I set up my care plan. Now, if you're not getting out of pain, it might dictate a change in the care plan because I want you to get to that point, and I want you to get there quickly because that is our goal. And we're human beings and we have compassion for our patients. Or that means maybe we're on the wrong track if we're not budging their pain at all either. Maybe we've completely misdiagnosed the patient and we better take another look at them. But if we're on the right track and we're getting their pain and their pain's on the dive and it goes below threshold, I don't go, well, gee, you're healed. What I go, hey, we're right on track. This is fantastic. And the truth of the matter is it takes a long period of time. So here's what we're going to do. For the next 6 months, we're going to see you once every 2 weeks and we'll reevaluate or whatever we're going to do at that point. It is an art to get there with the patient. You have to really read the patient where they're at as well. You will encounter a patient that will either do one of two things. I had one the other day that did this. Shook their head yes the whole time I talked to him. And the second I walked out of the room, I heard him say, this is what I'm going to do. And I went, I've done everything I can. Honestly, I can't go back in there and change it. I'm not going to go back in there and bark at them and change their mind. I'd already talked to him. I'd already told him, and I did a fantastic job of telling them what they needed to do.
Sure.
And he said, now, were they far off of my recommendations? No, but it was like, I want to be in charge. Okay. Be in charge then. That's fine.
Yeah. And the techniques we're talking about aren't going to convert every single patient once a week or twice a month or, even less than 4 weeks. But you're going to go a long way to creating doctor authority with patients. And I would have people that would refer me patients who just wanted a second opinion about something because they trusted my doctor authority to be honest about what they needed for whatever their condition was.
Right.
And that's really what doctor authority is just being honest.
Yeah. Use doctor authority, get out of their pocket. My challenge to you this next week is to look at your schedule. And I'd like you to look at your schedule 2 months from today. And I want you to look and tell me how many patients are on your schedule 2 months from today? How many for the whole month? What do you got on there? Is it 10% of what you have this month, what you saw this month? Is it 5%? Is it dead empty right now? Some of you schedules are dead empty 2 months from now. There isn't a person on it.
And I'm going to tell you, because you're all thinking, well, that's just how it works. That's not how it works.
No.
You should have, in 2 months, you should have about 85% of what you're seeing right now on your schedule, minimum. And if you don't know how to do that, catsconsultants.com.
That's and that's where it's really at, because if your patients are scheduled out in advance, called advanced multiple scheduling, you will, and you won't get 100% of those either. I live in a farming community where I have some people that are just, I want to call every month and schedule, or I want to call every 2 weeks and schedule, or every week, or whatever they're doing. They will schedule each appointment individually. We have a few of those, and it drives us insane because it's harder for us and harder for them because they don't get.
Sure.
We even, and we use little tricks like saying, we want you to get your preferred time
Right.
on the schedule. There are little verbal cues that we use to get people to kind of follow through. Sometimes they won't, but the truth of the matter is, if you look out on your schedule 2 months from now, and there is nobody, or if there's less than, I'm going to say less than 25%, I'm going to give you a little grace here. All right. If you have less than 25% of what you have on your schedule this month, 2 months from now, already, if you look out, I'm going to say you're a call me maybe.
Yeah.
You're a PRN Mindset chiropractor, and
and you may not even realize it.
Yeah. And you're bleeding patients as a result of that.
Yeah.
Because you got a lot of balls in the air that you're trying to juggle. I'm only trying to juggle a few.
And
Most of the balls have already been contained in the container, and I can look at a patient and go, oh, yeah, their next appointment is blah, blah, blah.
And if your schedule's empty, that's a lot more work on your staff to fill it back up, and fill it back up one day at a time.
Yep.
So get rid of nails on the chalkboard. Get rid of the PRN mindset. Quit telling patients, call me maybe. Call me maybe if the pain comes back. Call me maybe if you can't play golf again. Call me maybe if you can't bend over and play with the kids. Get rid of the mindset. You don't need it. use your doctor authority, make recommendations. And like Troy said a couple of times, get out of their pockets. That's not your job.
Nah,
All right, everybody. This was fun.
it was, and I think it gives a lot of insight into something that the chiropractors talk about a lot. And I think sometimes we don't understand quite why this guy practices the way that he does. I think what I'm doing is just fine. There is an easier way to practice. I can tell you this is easier. And
Way easier.
and I'm going to go out on a limb and say it's probably more beneficial to the patient long term because there's a cadence of care and there is supportive care that goes with what they're doing rather than allowing them to decide when they should come see you.
Yep. So go check us out, catsconsultants.com. There's a bunch of free downloads on there. We have virtual seminars coming up. We've got a live seminar coming up this fall. So if you want to learn more about what we do and the innovative things that we do to help practices become more profitable, not just busier. Okay. So we're not trying to make you busier. We're trying to help you work smarter, not harder, but be more profitable. So go check us out and we'd love to see you. So all right, Troy, thanks for being here today. From all of us here at Cats Consultants, and thanks to Chiro Health USA as well. We'll see you guys next time.
See y'all later.